In the spotlight.
Hello, and welcome back to the Hospital Association of Southern California's podcast series, In the Spotlight. I am Susan Harrington, president of Communities Lifting Communities, and I'm thrilled to be your host today. We are honored to introduce the founders of the Ventura County Community Health Improvement Collaborative, who have been leading and collaborating on improving community health in Ventura County for many years. Their innovative multi-stakeholder approach has recently awarded them a California Accountable Communities for Health Initiative grant. Today, we will learn about their health equity strategies that positively impact the communities they serve. Please welcome our esteemed guests. Seleta, could you please introduce yourself and your organization and share with us what it means to participate in the Ventura County Community Health Improvement Collaborative?
Sure. Thank you, Susan. I'm Seleta Dobrosky. I am the Director of Public Health Nursing for Ventura County Public Health, and I serve as the chair on the Ventura County Community Health Improvement Collaborative. And what I love about the collaborative is, as in its name, the collaborative approach that we take, all the different organizations that are part of the group that come together, the networking, the sharing, and really the collective effort to improve the health and well-being of our community, which is something that's very pivotal in the work that we do in public health.
Thank you, Seleta. And Manisha, please introduce yourself.
Hello, my name is Manisha. I'm an epidemiologist at Ventura County Public Health, and being part of the collaborative, I really enjoy seeing all the great work that the different hospitals and our different providers do, and being able to kind of center that and collaborate with everyone to see what other great projects and activities we can get out of that.
And Erin, please introduce yourself.
Hi, Susan. My name's Erin Slack, and I'm the Senior Manager for Population Health at Gold Coast Health Plan. Previously, I also worked at Ventura County Public Health when the collaborative was founded. But I think one of the great things about VCCHIC is that all of the organizations really have the same mission at heart to serve those most vulnerable in our community and find ways to better really work together to make that happen and improve health outcomes in our community. And it's part of what we need to do as organizations, but when we come together, we have that better collective impact. And we've seen that through some of the initiatives that we've been able to put forth. And so I think that that's how we're able to continue to work together, but then bring more organizations into the fold because they see the success we've had in working together in our community. I think we're really very a special kind of close-knit community. All of the people from the different organizations know each other, and it really lends itself to that collaborative nature that we have here.
So Erin, I'm going to have you continue to talk a bit about VCCHIC and the history of the collaborative coming together.
Sure. So it's a pretty interesting story in that I used to work as an epidemiologist at the health department, and we were going through the accreditation process. So in California, Ventura County Public Health was the first health department in California to become accredited through the Public Health Accreditation Board. And part of that requirement is to do a community health needs assessment. Well, at the same time, the hospitals in our community with their nonprofit status were required through the IRS to also do a community needs assessment. So as the epidemiologist, I would get inquiries from consultants or executives at the different hospital systems, also our federally qualified healthcare centers through their requirements had to do a health assessment. So they would all come to the health department and ask for data to help inform their health assessment process. So as we were learning about what the requirements were for our accreditation, what we really did at Public Health is we brought the organizations together that had a statutory requirement to do a health needs assessment and said, instead of all of us putting all of our resources into assessing the population, why can't we work together on the assessment process and maybe even work together on some of the strategies to address those health issues? And I think the first meeting that we had with the hospital systems and the federally qualified healthcare centers in our community was in 2016, I think all the way back to May of 2016. And at the time, I think everybody was receptive to working together, but it was hard in terms of the alignment because the hospitals were on a 3-year schedule. The health department was required to do an assessment every 5 years. And so what we really did was committed at that first meeting to continuing to meet and talk about how we could align our processes, but we didn't actually get to doing a collaborative health assessment all together until 2019. So the first published collaborative health assessment was in 2019. We began work on that about a year and a half prior. And so even starting, excuse me, to work on gathering that primary data and the secondary data as part of the health assessment process. And once we worked together as organizations to really define what those priority health issues were, everybody was receptive to even working on a plan to really address those issues. And I think that's when the true collaboration started happening, is when we identified those priority health issues together, and then we were able to put a plan in place in order to make that happen. And that was around the same time that, we had a little global pandemic. And so those efforts to work together as part of that assessment process and implementation planning really lent itself to better collaboration during the pandemic as well. So I think that those early meetings to really set the foundation for us to understand what the needs were in terms of assessing the population, those statutory requirements, lent itself to just better collaboration as we aligned those efforts and were able to kind of get away from, 6 different assessments of our entire community and get to working together on what we can do to address those issues rather than spending our resources thinking about what the priority health issues are.
I just want to add a little bit to what Erin said as far as the collaboration during the pandemic. Because of this collaborative, we were applauded up and down the state for how our county addressed the pandemic because we have such tight collaborations. And so this really, to Erin's point, set such a strong foundation for how public health worked with all of our hospital partners. It helped us to create systems for our really vulnerable population in our skilled nursing facilities when they, were positive with COVID, to actually have space at the hospital, to rehab and get better and create an isolation for them that would keep the other residents safe. I don't think any of those things would have been possible without the collaborative foundation that we had with VCCHIC.
Yeah, I think those relationships during the pandemic were key because we were able to call on our partners that we already knew. We didn't have to make that introduction during a very stressful time. They already were trusted partners, so it was really easy to begin that work together.
So in addition to the public health department and the nonprofit hospitals in Ventura County, who are the other partners at the table with VCCHIC?
So in terms of our founding members, we also have our behavioral health department that is part of VCCHIC, and then we have the Gold Coast Health Plan, who I work for. Ventura County Behavioral Health also has a requirement to do a mental health needs assessment. And so I think that they have really enjoyed being part of the effort because the data collection process as part of the collaborative assessment helps to inform their process, but also makes it so that we don't have to burden our community members about asking multiple times what they think about what the priority health issues are in our community. We can go and do focus groups and surveys to that same population and glean the information that we need. And the same is true with Gold Coast. I think that Gold Coast first became involved because of a requirement that we had internally to do a population needs assessment, but that was just really member focused, so included information on the members that were part of Gold Coast Health Plan. But what we really found is that the collaborative health assessment lent itself more to identifying those social determinants of health that were really affecting our member population and preventing them from accessing the services that we want them to have access to. And so it's really great now because the Department of Healthcare Services has realized that that member-centered focused population needs assessment isn't really the way that we learn most about our community, and they are requiring us to have these collaborations and work with the health department and nonprofit hospitals on that, and we've already established that in our community. So Gold Coast is actually in a great place as a Medi-Cal managed care plan because we've had this process in place for such a long time.
Thank you. Manisha, can you share some examples of specific initiatives or projects that VCCHIC has implemented to address health inequities?
Sure. So to start, we did have 3 prioritized areas that came out of the community health needs assessment. So the first was addressing mental health and substance abuse across the lifespan. And for that, for example, the county, we've distributed over 500 Narcan kits across the county. We partnered with VCOE to provide services among 5 school districts and various high schools. The next prioritized issue that we have is advancing equitable access to health care. And for that, we're partnering with Gold Coast to work on products to submit to DHCS. And then also we have our community information exchange. And then we also have the prevention of chronic conditions by promoting healthier lifestyles. And for that, we're working with hospitals to ensure that providers are educated. We're making sure that hospitals are certified diabetes wellness centers or education centers. And what else do we have?
Caregiver navigation.
Oh, yes, the Caregiver Navigation Project, sorry. Caregiver Navigation Project, which is actually from our last 2019 Community Health Needs Assessment cycle. And they actually just received additional funding to continue that on. So that was something really great. That was super impactful for the community that ensures that the caregivers that are providing care to others are also taking care of their own health as well.
Thank you. I'm going to go back to Erin one more time, and then Manisha, Seleta. So Erin, how has the CHIC grant influenced VCCHIC's health equity strategies and how we think it will influence the collaborative approach as we look to centering community voices a bit further?
I think CASHI, I just recently completed the health equity assessment. I think it's going to push our collaborative to think more strategically about how we're addressing health equity. I think we're identifying health disparities through the assessment process, but haven't really bridged the gap between the assessment process and the planning process and how to really address those inequities that we identify through that, through concerted efforts. And I think one key component of that is really pulling in the community voice to that, because those people that live in our community know the needs in their community. They know what's going to work best for them. And so we need that member voice to inform our intervention strategies. So we can identify a population through the needs assessment process that needs specific resources. But when we're designing those implementation strategies, we really need that member and community voice as part of that process so that whatever we decide to do, it will be more effective within the community. And I think with the CASHI grant, it's going to provide an opportunity for alignment, because I know that we're working on a health equity roadmap as part of that. And at the same time, we'll be working on our next collaborative assessment process in 2025 and the implementation planning. And so aligning those efforts will be key for us as we move forward so that we can make a greater impact at addressing those health disparities. And I know each of the organizations that are part of the collaborative have specific requirements to address health equity, but the way that we're addressing those isn't always the same approach. So I think that this would lend us to a better roadmap even internally for our organizations to take back. And this is the collaborative approach that we're taking at VCCHIC, but how can we at our organization internally also align with those efforts? And so I'm looking forward to really building out that roadmap so that we have a better idea of how we can work towards that at Gold Coast as well.
And I think having, the community voice piece is so important to all the work that we do. And one of the things that, is discussed a lot, among the county agencies, but just really across all of the organizations is, when we're looking at systems change or, just any of that work, how important it is to get feedback from the community. They like you said, they know their community the best, they know the resources, they know their needs, and they know what works and what doesn't work for them. And so I think we're really shifting how we do business in promoting access to healthcare, health equity across all of our organizations and through VCCHIC, because we're asking them, what would our system look like to best serve you? And getting that feedback and input from our community is really key.
Thank you. And Seleta, what advice would you give to other communities or collaboratives who are seeking to establish similar collaborations going forward?
So I think why reinvent the wheel? Look for things that are existing. Look for collaboratives, look for work, look for efforts that are already in progress or existing, and how can you leverage that work? Rather than building something from scratch, there's lots of efforts and opportunities, and that's what happened that's kind of how VCCHIC naturally morphed into what it is. And I think, looking at what organizations need to be at the table, inviting those partners, creating an orientation, creating an onboarding process so that they can, jump in and get started with the work, that they don't feel like they're on the outside passive observer, but that they're actually active in the work. Some of that also includes creating a charter so that everybody understands these are the goals, this is the mission, this is how we plan to get there. So everybody's on the same page, and it just creates some organization to the effort. And I think too, looking for those with lived experience in the community, again, is so critical in order to understand, how do our systems need to evolve and change in order to best serve the populations that we all serve.
I think I'll add to that.
Yes.
Especially for the founding members of our collaborative, we've always had people that are in key roles within those organizations that actually have the power to influence change within their organization as part of the collaborative. So it does require like a higher level management position to be in that leadership position within the collaborative if we're going to move any of these efforts forward, because it does take time to make change, and it takes even longer if you have someone that doesn't have the influence within their organization to make that change. So I think that it's key to bring in the partners that actually have some power within their organization to influence change.
Absolutely.
Is there anything else you'd like to add?
No, I think being a part of this collaborative has been an eye-opening experience, and I think that it has created partnerships, networking, and collaboration that probably would not have happened otherwise. And so the meetings are exciting. We're moving to in-person meetings more frequently, which is great. It helps to continue to build that collaboration. So, and we are very excited to have Communities Lifting Communities as our backbone organization in this work. The support that is provided is very beneficial, and I think it keeps us organized and focused and moving forward with all of this great work that we have going on.
Well, thank you. Thank you very much. And thank you to our listeners. Thank you to all of the collaborative members. And we really appreciate your time in enriching our understanding of this wonderful collaborative that's a model for the state of California. Thank you all.
Thank you. Thank you.
Thanks.
In the spotlight.